Hello, let's talk about painkillers today. So we have several classes and groups of painkillers. Painkillers known as analgesics, drugs that are used to relieve pain without necessarily putting the person into coma or without reducing consciousness or without loss of consciousness. So if you take any drug that lets your level of pain calm down without you losing consciousness, it's a painkiller or it's an analgesic. And we have different classes of analgesics. Today we are going to talk about a particular class or group of analgesics known as the Nsaids, non-steroidal anti-inflammatory drugs. So we have several examples of Nsaids, and today we are going to talk about ibuprofen, commonly known as brufen, and we'll also talk about diclofenac. So in this video we are going to talk about their mechanism of action, their adverse effects, their indications. Please stay tuned. Make sure to like, save or share this video and comment. Brufen or ibuprofen is commonly used to manage mild to moderate pain. It's not used for severe pains. Commonly used to manage mild to moderate pains like headache, like musculoskeletal pains, like joint pain or dental pain, menstrual cramps. This drug is commonly used for these purposes, and it also have anti-inflammatory properties. So because of that, it's also used for inflammatory conditions like osteoarthritis, rheumatoid arthritis. And then how does this drug work? That is the mechanism of action. So we are going to talk about an enzyme called cyclooxygenase. So we have cyclooxygenase, commonly abbreviated as COX-1. Then we also have cyclooxygenase or COX-2. So this drug work on these cyclooxygenase enzymes, and we are also going to learn about prostaglandin and their function. Starting with prostaglandins. Prostaglandins are mediators of pain and inflammation. It means that prostaglandins are necessary for someone to feel pain in your body, and they also promote inflammatory processes. And when somebody takes ibuprofen, it's a non-selective COX inhibitor. It means that it inhibits or prevents the work of both COX-1 and then COX-2. Now, one function of COX-1 is production of prostaglandins that helps in the protection of stomach lining by producing or secreting mucus that protect, and then bicarbonates that protect the stomach lining. And then the function of COX-2, this is not the only function of COX-1 though, but I want us to dwell in this because it has a side effect of this. And that of COX-2 produce prostaglandins that regulate pain, fever, and then inflammation. And it also produces prostaglandin in the hypothalamus that regulates body temperature. So now when someone takes Nsaids, example is that of brufen and then diclofenac, it inhibits this COX-1 and COX-2. So it means that the person will not be able to feel pain, and if there is inflammation going on, inflammation will reduce. If there is fever going on, fever will also reduce. If there is pain, as I said, pain will be reduced. And remember we said COX-1 protects the stomach lining, and it means that this person's taking the drug, the stomach lining is at risk, that there will not be that much enough protection. So that's saying us the side effect of these drugs. That is why they say that when you have ulcer or and when you are prone to getting ulcer, you should not take these drugs. And you should not also take these drugs even if you don't have ulcer for prolonged period of time, because you will be exposed to developing ulcer, stomach ulcer, peptic ulcer. Yes. So when somebody take these drugs for a long period of time, it means that the stomach lining is not going to be protected. The person can get ulcer. So that is one side effect of this drug. Just one side effect of this drug. That is health workers are usually most concerned with. But we also have other side effects like nausea and vomiting. Some people may take it and they will feel like vomiting, or they actually vomit. And if you take it in higher doses, you can have liver problems. They can have effects on your liver. So that is it for Nsaids today. We'll be talking about other analgesics in my subsequent videos. Thank you.